In this video, we're going to show you a home program that we gave to a patient that had medial knee pain. This particular patient went to their medical doctor. They had an MRI of the knee. It showed negative for degenerative joint disease, cartilage, meniscus damage. Basically, the knee was solid. However, when this patient would go out for a run, once he would hit the 3-mile mark, he started experiencing medial knee pain. So in this video, we're going to go over myofascial release and mobilization of this area. We're going to show you the proper exercises. We're going to show you how to self-release the lumbar spine so it improves the nerve supply, making those muscles work stronger and more efficient. Also, we're going to go over a technique for spinal molding so you get long-term benefits and stabilizations from this. Hi, my name is Dr. Rob Bates. I'm a chiropractor and a certified athletic trainer. Before you perform any of these exercises, make sure you consult with your healthcare practitioner to make sure this is correct for you. First step is myofascial release or mobilization of those areas. Very important. So you get a foam roller, lacrosse ball, or a softball. Take the foam roller. We got to release the calf muscle first because the calf muscle runs right up to the back of the knee, right in this area here. Bring your toe towards your head, start rolling across that calf, go to the inside of the calf. If you want more pressure, put your leg on it, find where there's a little tender spot. Once you find that, then you can go ahead and start flossing and releasing that calf more, about 30 seconds to a minute. Then work your way up to the hamstring. With the hamstring, same thing. You want to roll across it, go a little bit more on the inside, find where the tender spots is down by where the knee is. So that's typically going to find a big tender area. Then you find that, you can go ahead and contract the quad, relax, contract, relax. It's helping release that spot on the inside where those muscles run on the inside and attached to the inside of the pes anserine area. Your lacrosse ball or your softball, you can come into this area here. We're going to go to the other side so you can see this. You just want to release the glute medius, cross your leg, place it in that glute medius area, right in the glute, find that big tender spot there. Just put pressure on that area. Move your knee inside and out. Give yourself 30 seconds to a minute. Now we want to release the quad on the inside here. Foam roll. A little bit on the inside of that thigh. Find the tender spot. Usually it's going to be right in the middle of the belly of the quad. If you find that, then just go ahead and floss that femoral nerve and the muscle. Softball, place it in between the ASIS and the umbilicus. Start from the outside. I like to use my hand because I can direct the force easier. Come underneath. Feel that area. Feel where you can start feeling that tenderness of the muscle. Once you get that, you can contract the glute and relax, or you can come up and start trying to do a frog leg to release that hip flexor. I want to exercise. You want to get an elastic band. I like to use the slingshot. Come on up here, put it above your knee. Lift your toes up, dig your heels into the ground. You're going to do glute bridges, but then you're going to abduct the hips at the same time so you can activate the gluteus medius also. Come on up. Brace the abdominals as you do this and relax. You want to hold for a 10 count and then relax. You want to do between 10 and 20 repetitions. You want to do the 90-90 stretch for 90 degrees at the hip and the knee, and you just want to get in this position and hold for about 30 seconds. Rotate over and hold for about 30 seconds. You're going to find maybe the affected side may be a little bit tighter. In fact, when you get let's say if it was my left knee on the inside, a lot of times it's going to be a little tighter right up through this inside area. 3 to 5 times each side. You do self-release of the lumbar spine. You're going to bend your hip at 90 degrees, knee about 90 degrees. Use your opposite hand to apply resistance as you twist over. Keep your back and head onto the ground. As you're coming over in this direction, you're going to resist that motion. You're going to feel it stretch all through this area. Glute, along with the QLs, the obliques, the multifidi, the rector spinae. Resisting that, causing a stretch under tension. You may hear pops and cracks. So releasing of the lumbar spine until you get the SI joint. And you want to perform this about 2 to 3 times each side. When we do this, it's releasing the nerve supply, so it's going to free it up so those muscles will get better power, so it will perform better and be stronger for the exercises and for when you run. Now you want to get into a squat. You want to try to keep your toes pointing forward. It's going to get a little more pressure onto the hips that way. Take your elbows when you get into that squat and push your knees out. Try to keep your heels flat on the ground. And as you're in this, you want to try to stretch out 30 seconds to a minute. As you're doing that, gradually work into one side. Keep your heel on the ground so you're stretching out that ankle and calf. Probably going to find one side that's tighter. Most likely it's going to be the side that is affected with the medial knee pain. The medial knee pain is just not going to be medial knee. It's going to also affect all the way down and probably into the arch. And a lot of those people will have plantar fasciitis also. You're going to perform this, come back out after about 30 seconds to a minute, and you can repeat it again. Many patients with the medial knee pain will have a hypolordosis, which is a flattened lumbar curve that puts a lot of pressure on the nerves that feed all down that leg and weaken it. So when you put it under stress of running, certain areas along that line will break down. It's kind of like you step on the rock of the hose that's watering the garden, and down the line in the garden will start wilting. And you want to get in this position here. You want your elbows underneath your shoulders, and you want to sit in this position starting off 2 minutes and gradually working your way up to 10 minutes. This will allow for a remolding of the lumbar lordosis, so we get some long-term correction. Next is walk for 5 minutes before you start your run. Then you would start your run and you do your run, and when you finish your walk, you would go ahead and finish with another 5-minute warm down walk. If you want to learn more information on other ways that you can release the pelvis and lumbar spine, check out this video here. If you're new to my channel, you want more spinal-based home exercise programs, then subscribe right here. We appreciate serving you. Keep spreading the word. We'll look forward to seeing you in the next video.